The early stages of the pandemic were especially hard on all of us. The stay-at-home orders, social isolation, grief over loss of jobs and relationships, and fear of getting sick. All of these affected what we love to do, where we want to be, and who we want to be. More than a year into the crisis, it seems like we are back to where we were. Others will say the situation, in fact, is much worse, much harder on so many of us. I'm Dr. Freddy Gomez. This is MedTalk Health Talk on CNN Philippines, where your healthcare comes first. We all know how COVID-19 affects us physically, but what do we know about its effects on us mentally? Joining us in the discussion are Dr. Amadeo Alinea Jr., the immediate past president of the Philippine Psychiatric Association and department head of psychiatry at the Veterans Memorial Medical Center. Also joining us today is Mr. Nino Galakgak, the head psychologist at Heal Space Psychological Clinic. Thank you both for being here with us. Now, the COVID-19 pandemic is a large-scale traumatic event that's causing physical, emotional, and psychological distress for all of us. It's been over a year, and while we keep ourselves physically safe from the virus, not many of us have realized the impact on our mental health. Dr. June, what are some of the mental health conditions that has become more prevalent due to this pandemic?
Currently, a lot of individuals, especially the medical frontliners, are suffering from anxiety, and primarily this is a result of the prolonged treatment procedures that they have been going through. A 24/7 duties is really very difficult, and most of all, they try to prevent themselves from getting the COVID itself and bringing it home to the family. I think it's a very stressful thing to be working for almost 1 year already.
And one common mental condition that many people are experiencing is grief, which is in response to a loss of life, loss of a job, or drastic changes to our daily routines that usually bring us comfort and stability as well. Dr. June, how do we know if someone's experiencing grief?
They usually have the problems with sleeping, with appetite. Their social life becomes very much decreased, and functioning is very much affected. That's a very, very big indications when individuals are actually in the verge of suffering from a mental health condition.
Yes, that's right. Now, the isolation from COVID-19 can cause fear and loneliness, which may take a toll on your self-esteem. So, Nino, is this correct to say?
Of course, no, because of the adjustment that we had to do in relation to the changes that we are experiencing because of the pandemic. A lot of issues are coming into the surface, and people are becoming more aware of those issues, and talagang it may cause grief to many.
How does this affect their self-esteem naman, Sir Nino?
In terms of self-esteem, because of the loss of lives, loss of livelihood, and many other losses, nararamdaman ng mga tao na they are out of control sa situation. And then when you feel that the situation is out of your control, that's when you feel na parang you lack the capacity to handle all these challenges and difficulties. And so that affects your self-esteem.
And many of us are facing challenges that may be stressful, overwhelming, and cause very strong emotions. Dr. June, what are the most common problems people are experiencing due to this pandemic?
You have isolation, being away from a family for quite some time. You have the problem of socioeconomics, which is probably one of the most difficult thing of trying to balance health, safety, and economics. Then you have this fear of being able to contract the virus and bringing it home. And you also have those individuals with comorbidities or those with other medical conditions, because they see that they are more prone and that the effect of the virus itself can be more moderate to severe in those suffering from comorbid conditions.
Now, Sir Nino, let's talk about mental health counseling. How does it help address mental or emotional distress?
When you go to counseling, of course, you have the opportunity to discuss with a mental health professional all the issues that you are going through. Sometimes when it's just you who processes them on your own, it could get messy in your head. And sometimes the emotions could be very overwhelming. And if you talk it out to somebody who's able to untangle things for you, who could make things more clear to you so that you are able to explore the best options that you have and that you could make the next right move or decision to address what's bothering you, that would be the benefit of counseling at this time.
Yes, and Sir Nino, a lot of people actually with mental health issues don't readily seek treatment for their concerns. What's stopping someone from seeking the help that they need?
Well, primarily, although there's a growing awareness already in terms of mental health, there's still some sort of stigma or misconceptions about asking help from a mental health professional. Some people would think of it as a sign of weakness, while some other people would think that it's just for people who are very unstable or crazy, if I may use that word. We must admit that in the Philippines, at least, the cost is also an issue. Like, we need to provide for our basic needs. So sometimes mental health is not the top priority because you have to, of course, provide for what is basic.
That's true. And for those who think that mental counseling will help them, we definitely advise seeking that help. But seeing a counselor in this time of the pandemic could pose some challenges. Sir Nino, what are our options now? Yung ibang concern nila yung cost. Does insurance cover counseling? Ngayon, na face-to-face is not there. Is telemedicine for counseling appointments an option as well?
In terms of accessibility, it's a problem because there's like a limited number of mental health professionals. There's just a few hundred psychiatrists and around just 1,000 of psychologists. So it's really very difficult to access them. But because I think, fortunately, because we as professionals were also forced into transferring our services online, we have become more accessible. And in terms of affordability, since the mental health law was just signed, I think in 2019, Filipinos are already starting to access services and become more affordable for them because there are free hospitals and clinics, non-government organizations that provide free counseling.
Now, if you think that you might have mental health problems, you've already taken that first step, noticing that something isn't right. What should you do after this? More on this when we return. You're watching MedTalk Health Talk on CNN Philippines. If you think you're experiencing distressing emotions and have trouble managing them on your own, there are many different treatment options, including mental health counseling. We're Together in Health. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines. Mental health counselors are licensed professionals who treat the cognitive, behavioral, and emotional aspects of mental health. And seeking help is the first step towards getting well. It's common to feel unsure and to wonder whether things can be dealt with on your own, but it's always okay to ask for help. Sir Nino, can you walk us through a typical counseling session with you?
All right. So like what you said, Doc, no, it has to begin with making that first appointment. We call that the initial mental health consultation. It can be the most daunting part, but it's actually the biggest step that you can make towards recovery. You know, during the initial consultation, you would actually be allowed to talk freely about your concerns, and you could expect the mental health professional to give insight to what is going on based on what we've heard. And you could expect that at the end of the conversation, we would give you some recommendations. It's either we refer you to a psychiatrist if you need some medications. We would advise you on how frequent your therapy should be and what specific type of treatment do you need? And after that first consultation, we could begin already the work from there.
Now, Dr. June, in this day and age and this situation of the pandemic, does telemedicine offer the same interaction with that patient as face-to-face counseling?
In some cases, telemedicine would be suffice, but for some patients, they could not really help but do face-to-face consultation, because that I don't think that can really replace totally by telemedicine. Hopefully, we will be able to do a face-to-face consultation. But for now, telemedicine or telepsychiatrist, we call, is probably the best option to avoid being contaminated with this virus.
Now, the terms counseling and therapy are often used interchangeably, but there's a difference. Can you tell us what this is, Dr. June?
Well, therapy would have to use certain forms of modality using whatever models they would like to use, such as your cognitive behavioral therapy or your supportive therapy. Counseling would probably go more through the initial phase of what would be going on and seeing what would be an immediate management they can do to be able to relieve the conditions. As a psychiatrist, we employ several forms of treatment modalities, such as your psychotherapy, pharmacologic therapy, we do milieu therapy, all these things combined to be able to be more holistic in our treatment.
So, Dr. June, what you eat can actually directly affect how you feel. Does this mean that diet can help improve our mental health?
Yes, doctor. There have been already several studies that shows that certain dietary requirements or food that we eat has a lot of probiotics which actually improve mental health. In the nutritional aspect of diet, I think we have to make sure that we have a balanced diet that would be able to maintain the minimum daily requirements.
A lot of people want that rush they get or that elation mentally that they get whenever they drink caffeinated drinks or even energy drinks at that. Is this a good way to feel good mentally?
Well, actually, we have to just make sure that we put everything on moderation. There's also such a thing as addiction to caffeine. So most individuals will suffer from some headaches or migraines if they don't take caffeine, or they feel sluggish in the morning. But as I've said, everything is supposed to be in moderation.
And aside from the diet, I believe exercise is also good for our mental health. What are your thoughts on this, Dr. June?
Physical exercise is one of the best way of improving one's physical and mental health, especially at this time when we are all in a very sedentary lifestyle, staying at home most often, being couch potatoes.
And Sir Nino, in your opinion, what type of physical exercise or even mental exercises would you advise our viewers to try for better mental health improvement?
If you're familiar with mindfulness, the way that you are aware of your thoughts and your feelings rather than suppressing them or trying to eliminate them out of your system, it's a good psychological exercise that you try to be more mindful of what's going on both in your mind and with how you're feeling.
We'd like to thank our guests for today, psychiatrist Dr. Amadeo Alinea Jr. and psychologist Sir Nino Galagak. We appreciate your time and effort. Therapy is a perfectly normal and valuable experience. When we come back, you'll hear this straight from someone who's been there and benefited from it. You're watching MedTalk Health Talk on CNN Philippines. Welcome back to MedTalk Health Talk. Mental health issues are common, but only a few get help. If left untreated, these often get worse and may have other negative consequences. To join us in our discussion, we have content creator and mental health advocate, Ms. Martha Hante, who was diagnosed with generalized anxiety disorder caused by several COVID-19 related reasons. First of all, thank you for joining us, Miss Martha, and giving it your time and sharing your journey with our viewers. Could you please explain to us why you went to therapy? What was the factors that made you seek professional help?
Actually, I was diagnosed with anxiety 4 years ago pa po. And I was getting better na. And then when COVID-19 hit, parang back to zero na naman ako. Parang lahat nung progress ko years before COVID, parang nawala siya bigla, parang bumalik siya. The reason why I opted to go to therapy, actually I went to a naturopathic doctor and acupuncturist, and then sila rin yung parang therapist na kinakausap ko about what I feel and everything, is because I know I needed help. Kasi hindi ko na siya ma-manage mag-isa. Hindi na ako nakakatulog, kakaisip. Pangalawa, I'm feeling the physical manifestation of the anxiety, which are headache, parang nanginginig yung katawan, and there's a lot more physical manifestations na matatakot ka talaga na akala mo meron ka ng malalang sakit, not unless you know, manifestation siya ng anxiety.
Martha, what was it about the COVID-19 situation that brought you back to the state that you were 4 years ago? Ano ba ito? Naging positive po ba kayo with COVID-19? What happened during this pandemic?
Well, at first, I was supposed to get married May 2020. And nag-lockdown tayo May 15, and umaasa pa ako nung una na hindi siya ganun tatagal na matutuloy tayong kasal. But as days and weeks go by, na-realize ko na it's not gonna happen. So all the effort ng 1 year of preparation ng wedding, napunta sa wala because it was all over. So number one reason yun. Second, my brother-in-law died of COVID. And iba yung pakiramdam kapag someone close to you died already of COVID. Parang feeling mo it will get you anytime.
It's good that you were able to get professional help when you did, but how did therapy help you directly? What did you learn from it?
What I learned from therapy is how to distract myself from the invasive thoughts. So therapy helped me a lot, distracting myself, like grounding techniques, breathing techniques, ganyan. Para kapag yung invasive thoughts na magkaka-COVID ako, mamamatay din ako sa COVID, or yung parents ko na senior, magkaka-COVID and they will leave me, parang gano'n. Once the thoughts come in, parang spiral na yun spiral down. So therapy helped me a lot. Para yung thoughts na yun, ma-shoo away ko agad before pa ako talaga mag-ball into like depression.
Now, how is your day-to-day now, Martha? Like after going through therapy, how are you coping now with this pandemic?
Well, I still have those days na sobrang napapraning ako. Especially kapag marami akong mga kakilala na nagkakaroon ng COVID, tapos hospitalized and stuff. Pero mas better na ngayon kasi natutunan ko na yung coping mechanism. Once you know how to cope with it and how to manage it, hindi naman mawawala yung anxiety kasi ang dami kong kilala ngayon na wala namang anxiety disorder like me, pero sinasabi nila sa akin, ganun pala yung pakiramdam ng ina-anxiety. Yun yung nakakatulong sa akin, meditation, grounding techniques, tapos meron pa rin akong medicine for anxiety na tinitake. And then also, syempre, importante na you have support system. Very important. And my partner is very supportive, and parang ngayon, I'm just trying my best to live day by day and be healthy and hindi lalabas ng bahay if hindi kailangan para at least iwas sa kapraningan sa pagkakaroon ng COVID.
We are glad that you are in a better place right now, Martha. Now, for those who are scared to go to therapy or yung mga may iniisip na stigma associated sa pagpunta sa isang therapist, what is your advice for them?
My advice for you guys, I know there's a stigma that when you go to therapy, magkakaroon ka ng label na, ay, baliw yan, or she's crazy or something like that. Don't be scared because what other people will say shouldn't matter at this point. What matters is, kailangan gumaling ka at kailangan malagpasan mo yung phase na yun sa life mo. Because trust me, if you stay there, it's very hard to stay in that ball. Kailangan ma-realize mo na yes, I need help. Yes, I have this mental health disability. And walang dapat ikahiya, guys, because it's just like any other sakit. Kahit parang ubo lang yan, or kahit parang lagnat lang yan, or kahit anong sakit na kailangan mong pumunta ng doktor. Mental health disability is just like that.
We wrap up another interesting episode today. I'd like to thank Ms. Martha Hante, our content creator, for sharing her story with us. Early help for a mental health concern can make a big difference. A good place to start is to seek advice from your primary care physician who can guide you to taking the first steps and getting you the right support. Know that there is nothing wrong in seeking help. It actually takes a lot of strength to ask for it. No one needs to suffer alone. I'm Dr. Freddy Gomez, helping build a healthier future for you. Thank you for watching.